So we made it to page 313. So I'm happy with that. When you are checking for hospital chart, you have to make sure that there is a discharge summary and the admission note. So while we are waiting for the doctor, I'm just gonna eat here in the car. It's so funny, and I'm so sorry that the week in the life of a medical coder turns out like this.
This is precious.
Good morning, friends. Today is Monday, and for this vlog, we are going to do a week in the life of a medical coder. We did a day in the life last week, so in the recent upload, so let's do a week in the life of a medical coder. In that case, you will see the routine. This project will be done by April. Next month, so I am very excited for that. So we are asked, or they requested, if we can do some overtime, and I said sure, but I can only do extra hour every day, so I'll do 5 hours this week again, 1 hour each day, and then so my weekends will be free. We do assessment bi-monthly, and that is to check the coder's skills and knowledge of the project that they are currently doing, or just to assess the coder's overall understanding of what they are doing monthly or bi-monthly. And we do that every Monday, twice a month. So it's the time of the month that we're gonna do it today at 8 a.m. my time. Currently it's 7:50, so I'm doing one more chart to before I proceed to the assessment. Assessments are scary for me because you have to prove your understanding of the coding guidelines, and so you have to really double, triple, quadruple check your assessment, your codes that you report. And that's what are we gonna do today. Right now we still have 9 minutes left before the assessment, and let's code some encounters here. So we are 2 minutes away from taking the assessment, and we have condition to report in this encounter. There is actually a history of cancer of the tongue, but there was a dissection of the cancer. There was also 18 months of treatment, and there was no evidence of the disease in this encounter anymore, so we do not code that cancer code. But there is thyroidectomy for this encounter, or for this project. Thyroidectomy, which is E89.0, does not risk adjust. But we also found here one condition that can be reported, which is the COPD, chronic obstructive lung disease, or J44.9. We can report that because that is a reportable condition, but the cancer code will not be reported. And that's it. My medicine alarm is on. So it's 8 a.m. now. It's time to take the assessment. I have an hour to do the assessment, and let's go. So assessment is done, and that was so crazy. Whew. I mean, I think that was the most difficult assessment for this project yet, in my opinion, because oh my goodness, it's like almost all of them are cancer charts, and I hate coding cancer chart. It's so difficult for me. It uses a lot of brain cells. So I have a headache now. I feel like I have a high blood pressure. I have to probably I feel like I'm hypertensive now. I feel like I have to check my blood pressure, but yeah, I was over 1 hour. I You supposedly have to just do it for an hour, but I feel like I did 5 minutes over. It's time for lunch, and we made pasta. It's the easiest lunch to make. Pasta for lunch and some broccoli. So we just are getting ready to eat lunch, and after lunch, going back to work because it's Monday.
My name is Colleen,
Having pasta and broccoli for lunch, and I'm watching a tiny house tour. Work is done. I mean, not quite, because I am going to have my 1 hour overtime for today, and tomorrow, Wednesday, Thursday, and Friday. Let's go to the craft room. I will be back in the office later for 1 hour overtime, but let me show you the craft room. And it's so messy, super messy. And I actually have so happy with this. I finished this yesterday, and this is the first tote that I made. Ta-da! Isn't that so cute? Look! And there's my logo. Ah, that is so cute. Hello friends, good morning. It is actually 8:50 in the morning now. After breakfast and starting coding, starting working, we were not able to capture any footage. Mark had like a call almost all morning, so I cannot talk while he is talking. I was not able to finish a 500 pager chart, and that I have to carry it over today. And yes, I have finished several charts already, but now I am currently working on this one. Yesterday, when we were doing the overtime, this 500 pager chart, we were able to reach 188, page 188. And now this is my second time to work on this morning. I worked earlier this morning for this chart for like 30 minutes and then come back, pivot to other charts, and now it's my second time working on this for another 30 minutes, so we can balance our numbers. Okay, so we made it to page 313, so I'm happy with that. We are doing good. So let's just continue working and then code this. All right, friends, let's code an encounter. Let's code a chart before our lunch break. So what do we have here? It is an ER visit. So we can code acute conditions. Let's go directly to the assessment first and see what are the diagnoses. So first we have septic shock, that is R65.21 and A41.9. We have acute respiratory failure with hypoxia and hypercapnia, that is J9601 and J9602. There is acute kidney injury, but that does not risk adjust in this project. There is neoplasm of right lung, but we have to make sure that this is a new or recent diagnosis, or there is current treatment, so that we can report it. So let's go back to the top. Hi, Baba. So he was diagnosed with a stage 4 lung cancer in November, and this is now January. I don't see any current treatment for the cancer. Their patient-reported condition are not to be reported because patient can just say whatever diagnosis or conditions they might have, but the doctor or the provider must be the one to confirm the diagnosis or assess the patient. So I don't see anything yet about the lung cancer. I don't see any resection or treatment, so I am not sure if I will be able to code that, but let's continue reading. Just coming in to let you know that we have finished this 500-pager chart, and it actually has 146 encounters. I'm so happy. It's finally done. That's the biggest chart for the day. And yay, I'm done with that. So even before lunchtime, we've finished that one. So yay to me. Have again our leftover pasta because we did a big one. We made a big one yesterday. Finally, we are done with that 2,400 pager chart. It has 105 encounters. So yay, the big chart is gone, and it is currently 3:08 p.m. So we still have less than 30 minutes to code, and I am tired. Let's code more and more and more and more. We are not doing overtime today, but we are making up for overtime tomorrow because my charts are big today, and then I'm gonna watch that TV series. So. Good morning, friends. Today is Wednesday. We made it to the middle of the week, and we are now going to start working. Yes, I am wearing the same hoodie because I love it. Why not? With my dog behind me, let's start coding. So let's go to this encounter. So the patient is here for a follow-up on hypertension, depression, hyperlipidemia, rheumatoid arthritis, and pre-diabetes. So there's only one code for that. I mean, one reportable condition, and that is the rheumatoid arthritis. So we can code that. But let's find out if there is a more specific form of RA. And yes, it is rheumatoid arthritis with positive rheumatoid factor involving unspecified site. To index that, we type arthritis, rheumatoid with rheumatoid factor seropositive. The code for that is MO5.9. And that's the only code that is reportable on that encounter. Let's move on to the next one. Lunchtime. Okay, for lunch, it's the time of the week to DoorDash because that's the reason why I do overtime. I overtime because I don't want to cook. And we're having chicken salad. Ah! Yummy. Thank you, my love. Let's eat. Friends, I have one hospital chart that I'm gonna code. Hospital chart is not like hospital chart, you are just going to code the whole entire stay, not every day that the patient is in the hospital. So, for example, if the patient is from January 1 to January 15, the patient was in the hospital, you are not coding January 1, January 2, 3, 4, 5. You are coding the hospital stay, the total stay, and that is only one chart, or that is only one encounter in total. So that's what I like about hospital charts, because you're not coding each stay. You are not coding each stay, but you're coding the whole inpatient stay. So that's really my favorite part of coding hospital charts. So now here, let's talk. And for hospital charts, we really start coding from the discharge summary, because that's where the final diagnosis of the patient, and where you can also see some conditions, some conditions that were ruled out, and some specificity. And you can see like the whole interpretation of the patient's condition in the discharge summary. That's what I think it is. All right, let's start coding now. So the diagnoses are bipolar 1 disorder current. That's the first one. Current or most recent episode manic with psychotic features. So for me, that is F31.2. And then there's also tobacco use disorder, which does not risk adjust. But the primary diagnosis is the bipolar 1 disorder, current or most recent episode manic with psychotic features. So that's it. That is in the assessment. And we can also read more about the stay in we can read more about the stay by reading each encounter or each charts. So let's start here. Maybe we can see other conditions. So far, we only have one condition, the F31.2. So I just got back from lunch, and that lunch was delicious though. Okay, let's continue. I don't see other conditions, so maybe I will keep on reading until we find or we can spot the problem list or medical history list of the patient. So far, there's none. So let's continue reading all the encounters here. There is hyponatremia, which does not risk adjust. If there is also a diagnosis of depression and there is bipolar disorder, we code the bipolar disorder because depression is inherent on the bipolar condition. I think that's what I understood. So for the rest of the encounter, I will just keep on clicking and reading and finding other conditions and reading the patient's the patient's chart. Another thing I like about coding hospital charts is like hospital charts are big charts because of course patients are staying there for a long time, right? So there are like 1,000 pager charts or 500, really huge chart, but you only have to code one, and you have to carry all the conditions in one encounter. I'm halfway done on this chart, but there's nothing else, I think. Okay. Yeah, it's just depression and bipolar disorder, and of course we have to get the bipolar disorder. There's insomnia, there's constipation. Those do not risk adjust. So my dog just heard another dog barking, and now he's in panic. He wants to go out. So the patient actually stayed in the hospital for like less than 15 days, and for the whole encounter that I'm reading right now, there's only one condition, and this is a psychiatric progress note. So for the whole encounter, I don't see other condition except for that's reportable, and that is the bipolar disorder with psychotic manic with psychotic features, and then there's tobacco dependence, which does not risk adjust. So I think that's it. We only have one condition and we can submit this one, but of course we do not do that easily. We have to review the whole chart. We have to make sure that we are coding everything and complete coding and accurate coding. So while we are waiting for the doctor, I'm just gonna eat here in the car. Mark got something from the grocery store next to the urgent care, so let's eat. Good morning, friends. Today is Thursday. One more day before Friday. We are doing a hospital chart right now. In my list, I have two charts, two hospital charts. So let's start with this first hospital chart, and we are going also to use the hospital or the HCR guidelines instead of the normal guidelines, because this is it. Excuse me. This really is a complete hospital chart. It has when you are checking for hospital chart, you have to make sure that there is a discharge summary and the admission note. So if those two are there, then that means that is a complete inpatient stay. So let's start. I found here first the discharge summary, and the discharge summaries is found on the very first few pages of this chart. I just have to look for the admission, and yep, I found the admission here. Let me see. Just have to make sure that there's no other HNP. So a hospital chart is a little big, a bigger chart. There's a lot of pages, but again, you only have to code the whole thing, not each individual stay. So the first thing you have to do is really scan the whole chart to make sure that you are not missing anything, or you are coding one inpatient, you know how many inpatient stays are you coding. So just skim through it. Okay, so the patient's problem or the diagnosis is the patient has suicidal attempt. That does not risk adjust, so let's look for other conditions that are more specific, maybe psychiatric problems that are more specific and are reportable. So let's just keep on reading. Okay, here. So we have major depressive disorder, severe, recurrent, without psychosis. I believe that is F33.2. Yes, major depression, recurrent, severe, without psychosis. That is F33.2. The patient is cannabis dependent, so we type dependence, cannabis, and that is giving us the code for F1220. So far we have two conditions that are reportable here: the depressive disorder severe and the cannabis dependence. Here in this encounter, there is a past medical history that is not reported by the patient. So we have asthma, rheumatoid arthritis, seizure disorder. Those three are reportable, but in order to report them, because they're in the past medical history, we have to make sure that they are a current treatment, or there's like a medication to support that those medical history is still current, if that makes sense. So we have to look for asthma, rheumatoid arthritis, and seizure disorder medication. And because this is a hospital chart, we have to make sure that there is a whole medication list. But actually, I found out here that the asthma is found in assessment, so we can code that. J45909. Also, we have rheumatoid arthritis, MO6.9, and epilepsy, G40909. So we 1, 2, 3, 4, 5. There's already 5 conditions. There are already 5 conditions that are reportable. So again, I'm doing hospital chart, so there's a lot of reading. There is stimulant use disorder moderate. And moderate, let's try dependent stimulant. Yeah, stimulant use disorder in moderate is considered stimulant dependent, so that is F15.20, and we can report that. So that is the 6th condition. So let's continue reading. I'm just looking at the surgical history, if there's like amputation or transplantation, but there's none. This hospital chart has 1, 2, 3, 4, 5, 6 conditions, and yes, that's how, for me, that's how easy it is if coding. That's why I love coding hospital charts, because you are reading the patient's, or you are understanding the patient's condition as a whole, the whole inpatient stay. You are getting more information than just like each end of coding each stay individually, if that makes sense. So we are done with this, but I'm gonna double check. I'm taking my break in the morning. I have my 15 minutes break in the morning, and what are we gonna do? Let's share a story of what happened yesterday. So yesterday I was planning to make up for the overtime, right? I was planning to do 1 hour and 30 minutes today and yesterday, but yesterday we went to the urgent care because yesterday morning when I woke up, I had pain urinating. I had a little bit darker urine than usual, and then it was difficult to urinate in the morning, and it has lessened. The pain has lessened until the afternoon, but I waited until work is done before we went to the urgent care. The symptoms are like the UTI symptoms. So yeah, I had pain on my both sides. I have my kidney transplanted here, so but the pain is more likely on this side, and it's on the back, front and back, as well as on this side. Whenever I urinate, it feels more painful on that area. And then, but it has lessened, the pain has lessened all throughout the day, but there's still pain. So after work, we called my nephrologist, and then the advice was like, going to the ER is not worth it. If you want to be tested with UTI, then just go to the urgent care. So we went to the urgent care, and then the first urgent care we went to does not accept my insurance. I don't know why. And then I have a secondary insurance because we had like a dual, what do you call that? But my secondary insurance is from Mark's work. So, but they said they will not accept a secondary insurance. It's like, okay, let's just go to another urgent care. So we went to another urgent care, and good thing my insurance, like, it was accepted there. So we went there. They took my vitals, and then it was not a long wait. They took my vitals. I had urine sample, and then after like maybe 30 minutes, I was called to talk to the doctor, and then their urine test came negative. There's no like trace or there's no strong evidence that I have the UTI, which is really good. I'm happy with that. Praise the Lord. So there was no UTI, but I want to know why. And when I did the urine sample, my my urine was clear already. So it's like, okay, that's a good sign. So there was no strong evidence of UTI. He said that there's no like red flags on the urine sample that I gave, so that was good. But we still wanted to have to be sent it to send it to the lab so they can do further test about it or whatever. So yeah, because the pain has lessened. There's no more pain when I urinate, but I still have pain on this side more. And when I touch it, it like radiates to my other side, and like yeah, so it's becoming painful. But the pain this morning has been like consistent. It's not very painful. It's not less pain. It's not gone, but it's not super painful. So I just want to know, why do I have pain on this side? And the funny thing yesterday, because Mark has a lot of questions to the PA in the urgent care, he said, "No, there's really nothing wrong. I don't see anything wrong. I don't see any red flag." And then, so he went to my back and he punched my back. Like, I don't know. He like, oh, there's no pain on the other side, and on the right side first, and then the left side. Like, oh, there's no pain. Yeah, there was no pain. But after that, when we went home, I was like, I think he thought that I'm a big girl because he punched me that hard. It's a little bit sore. So yeah, so I'm just happy that there was no UTI. But yeah, we are trying to make an appointment with my PCP to do more, like, if my symptoms of this, if this pain will still persist in the next few days, then I need to see a doctor, my PCP, then my nephrologist. Yeah, but the main point here, I was not able to do overtime yesterday. Tuesday I did not because we watched our TV series, and then yesterday, Wednesday, I did not because we went to urgent care. And today I might not go overtime for the rest of the week just because I wanna rest after work. Even though I can, but Mark suggested that no, just don't do overtime. You're fine. Yeah, I don't really need an overtime, an extra money, or a lot of, well, I don't really need to do overtime, but I just want to help. But yeah, I think my body first. I need to rest a little bit or just watch TV or relax after work. So yes, that's it. And I will just have to edit for my commitment of 5 hours overtime this week. I just have to tell them that I cannot for this week, but probably next week. At least I started with 1 hour this week, 1 hour out of 5 hours overtime. Yeah. I really just want to do overtime. Besides that, they need some people to do overtime. I just really want to do overtime because the extra money that I get is like what we do for like eating out. I sometimes don't like to cook. I sometimes like to go outside and eat. So yeah, mainly if there's something I want to buy, I don't want to get it from my paycheck. I want to get it from the like overtime money. So yeah, it was an eventful Wednesday, but
You had a good sandwich.
yes, I had a good sandwich while waiting for the result or being called in uh, for the doctor. Mark went to Sprouts next to the urgent care, and he bought, because it's already like our time to eat dinner. So he bought sandwiches, tuna sandwich for him, and then I had ham sandwich, and he bought banana, and he bought crackers, and he bought he bought a lot. Like we're going to a trip. I think I think you thought we're going to a road trip. So yeah, it was a very eventful Wednesday. So again, for the rest of the week, I'm not going to do overtime. So that's an update and a story for this week. I bring you to a week in the life of a medical coder, but I ended up going to the urgent care. So sorry. So next time we will do a very normal. We'll try to not go to an urgent care when we film a week in the life of a medical coder. I guess that's an update, and I'll see you later. Good morning, friends. Today's Friday, and yes, we are not in the office. We are in the craft room, and I'm trying to eat my breakfast. It's currently 7:39. Yes, it's so funny, and I'm so sorry that the week in a life of a medical coder turns out like this, because yesterday, while working, I was not able to finish actually filming the rest of the Thursday vlog because I need to rest. I feel like the pain was increasing, especially on the back part of my transplanted kidney, where my transplanted kidney is. There's a throbbing pain, and it's more noticeable from like the pain from scale of 3 it went to 5, and then it's the same thing on my left side. There's a wave of pain that radiates going to my transplanted kidney. So my husband, Mark called the office. Mark called for an appointment for the PCP and then the nephrologist, until my nephrologist told us to come today in the morning. So that's why I love this job because the flexibility it gives me. And I actually asked my supervisor if I can just work half a day today, but she said no, just take your sick day and feel better. That's why I love this job, because it really is like they understand what I'm going through, and my supervisor know that I'm a post kidney transplant, so she understand. But that's what I'm worried as well, was like, I think this is the first time in my 3 years as a medical coder that my first quarter, January, February, and March, I already took 4 sick days. One in January, 2 in February, I think, and then 1 in March. So I'm worried that it will be count against me, but I'm also happy that she understands. So yeah, I will probably ask my supervisor when I come back on Monday, like, what's am I still doing okay? Will I be kicked out or fired? Something like that. But yeah, I'm hoping that for the next months that I will not be able to take a sick day if not necessary. Well, they're all necessary, but I just don't want, I just don't like it, you know. But yeah, so we are now, I'm now, I have a sick day today. I'll be seeing my nephrologist because he said he needs to see me, so they put me in their schedule today. He needs to see me if my pain or what the symptoms. It started as like I feel like it was UTI symptoms, and then it was ruled out. So I'm thinking, so it's nice that he told me to meet him, to see him today, because we don't know if it is ER worthy pain, or he has just to prescribe me something or whatever. So Mark is still working, and while I'm waiting for my appointment, I will just be resting here in the craft room, probably just lay down there. But yeah, I really slept in today. The pain last night was bearable. It was 4, 5, but it's noticeable. And when you are transplanted, when you have a transplanted kidney, it's worrisome because they said you will not feel anything if your kidney is rejecting, but I'm feeling pain, and I hope it's not rejection or failure. I just want to know what's going on so we can cure it or we can do something about it. And yeah, that's it. So start time for Friday. So Friday we will end the vlog with a week in the life of a medical coder going to a nephrologist clinic. Uh-oh. But yeah, that's it for a week in the life of a medical coder. Thank you so much for watching and understanding the course of this whole vlog. So thank you so much, and please pray that everything is just okay, and it's just like a muscle pain or whatever, that it can be cured right away. Thank you so much for watching, and I will see you in my next one. Bye.